COVID-19 vaccination is recommended whether you are planning a baby, already pregnant, or breastfeeding, and it is the best way that you can protect both yourself and your baby. So why is the COVID-19 vaccine so important in pregnancy? Although pregnant people don't appear to be more at risk of getting COVID-19, the severity of the illness and the risks are much higher than the general population if you do get it. These include being 5 times more likely to need to come to hospital, 2 to 3 times more likely to need ICU or breathing support. And for the pregnancy, there's an increased risk of premature birth before 37 weeks, which has its own risks and impacts for the baby. There's also a higher rate of stillbirth. So what can you do? Well, the most protective thing that you can do is to get vaccinated. Between February and July 2021, there were 742 pregnant women admitted to hospital in the UK for COVID-19. Of these women, 738 were not vaccinated. Only 4 had a single dose of the vaccine, and 0 were fully vaccinated. This means that 99% of women who needed to come to hospital for COVID were not vaccinated, showing just how effective the vaccine's protection is for pregnant women. There is strong evidence around the safety of mRNA vaccines in pregnancy and breastfeeding, and currently Pfizer and Moderna, both mRNA vaccines, are available in Australia, and pregnant women are a priority group. There's no specific time in pregnancy to get the vaccine, it's just important to get it as soon as you are able. It is recommended though to leave at least 7 days between a COVID-19 vaccine and other vaccines, like the whooping cough vaccine or flu vaccine. The side effects from mRNA vaccines are very similar in pregnant people compared with non-pregnant people. Most commonly, it's some pain at the injection site. Other side effects such as headaches, fatigue, muscle aches, or a low-grade fever can occur, but happen actually less often in pregnant people. These side effects are usually mild and will self-resolve very quickly. With all the talk about COVID-19 vaccines, some common concerns and myths have come up that we'd like to address. There is no evidence that vaccination causes any abnormalities or pregnancy complications. However, pregnancy complications are increased if you get COVID-19 itself. So having the vaccine will actually help to prevent this. There is no evidence that the COVID-19 vaccine impacts fertility in women or in men. Whilst it's not possible to be 100% sure of any long-term effects at this stage, there's no biological reason why there should be any. And we can be certain that having the vaccine is safer than the high risks of getting COVID-19 while pregnant. The vaccine itself doesn't enter the breast milk. Some studies have found that perhaps some protective antibodies that the mother makes in response to the vaccine could pass into the breast milk, which may help protect your baby against COVID-19. COVID-19 vaccines are safe, whether you're trying for a baby, already pregnant, or you are breastfeeding. They are the most effective protection that we have against the serious risks of getting COVID-19. They're free, and you can book in to get yours as soon as possible as a priority group, and your partner can also get one. We want to keep you and your family together during pregnancy, birth, and beyond. And the best way to improve your chances of keeping healthy, staying together, and being COVID-19 free is to make sure that you and your support person are vaccinated. If you have any questions or you need help booking your vaccine, please speak with us at your appointment today, or you can chat to your GP or visit coronavirus.vic.gov.au.